okay? That gives you ischemic pain, folks. Is everybody clear, folks? That's because why? We said yesterday, whenever the uterus contract, it collapses the blood vessel. So that's the idea here. Now, the bottom line is production of prostaglandin is the key for menstrual pain. Is everybody clear, folks? Okay. Now, mediated by prostaglandin, it's right there. Now, the biggest problem, we get a lot of patients, they come, especially teenagers, they're in pain and all these things. So I'm giving an example. If a person comes and say, I'm making up this date, 5th of the month, my pain starts, okay? 5th of the month, the pain start. And after the pain start, on the 6th, I couldn't handle it, I took ibuprofen. And then ibuprofen didn't help that much. And then I'm over with the menstrual cycle, so I'm okay. The mistake they make, if you really want the help from the menstrual pain, you are supposed to take ibuprofen on the 3rd, 2 days before you even start. Because you want to take ibuprofen for the prostaglandin to be inhibited before it's even produced. Is that clear, folks? Once they produce the prostaglandin, you take ibuprofen, it will only help for the new prostaglandin to be inhibited. Whatever you already have can't do nothing. It's like warfarin. Is that clear, folks? So what we tell the people, if you have the pain is that severe every cycle, don't wait until you get the pain. Take at least a dose day before your timing normally. Even if you feel mild pain, take it. The normal psychology of a human is they wait until it gets to where they cannot handle, then they take the pain medicine, right? So we always tell them they have to take at least a day before the pain start. That's the only time it can help properly. Otherwise, it will not be that much of a help. Is everybody clear, folks? So that's something important, right? Now, don't ask yourself, what if I don't get a pain this time? So why should I rush and take ibuprofen? If you are getting it every month, there is no exception. 1 month, you won't get it. Is that clear, folks? So that's the idea, okay? So that's primary dysmenorrhea, folks, okay? Is everybody clear? Okay, now you could ask me, it's a prostaglandin, how can acetaminophen, that's your Tylenol, help? Tylenol is not an anti-inflammatory medication. It cannot inhibit prostaglandin, but that acetaminophen can help you with little analgesia. It helps you with the pain. Basically, your prostaglandin is there, it's doing the pain, but it's blocking the sensation of pain that you feel. Is that clear, folks? All right, so that's the primary dysmenorrhea, folks, okay? Now, in my country, Sri Lanka, I was there once. I was told that whenever female get menstrual cycle, and if they're in a really pain, they give like 1 shot of brandy. It's like a cognac, right? And they put a pepper in there, they do some home remedy, and they say they give, and the pain goes away. I was like, pepper doesn't create anything. It's a bloody hell, the person is high. You don't feel any pain when you take that 1 shot in empty stomach, right? I mean, they take it and they go to bed. I was like, I like that. You take the shot and go to bed. It's basically you're becoming high so you don't feel the pain. That's all, folks, okay? So technically, you have to inhibit the prostaglandin that causes the pain, folks. Okay, so that's primary dysmenorrhea, folks, okay? Now, I want you guys to go find this page. Page 672. The entire page is high yield, folks, okay? You cannot miss a single disease in this page. Okay, very important, folks. Now, we divide this into non-neoplastic uterus conditions and some uterine neoplasms. Okay, so let's start with. So let's draw. So let's say that's uterus, folks. Okay. Now, uterus has 3 layers we talked about yesterday, right? So we said we have 3 layers. Now, first one is, I'll put E, endometrium, myometrium, and perimetrium. Is everybody clear, folks? That's the 3 layers here. Now, what do you have in endometrial layer? That's a question. Endometrium has something called endometrial gland, endometrial glands. Endometrium has endometrial glands. Okay, so that's a normal location and position. Sometime you could have a pathology where all of your endometrial gland is moving into myometrium. So all the endometrial gland is moving into myometrium, folks. That's pathology because they are going to a different location. Is everybody clear, folks? When endometrial glands migrate to myometrium, we call adenomyosis. That's simple. Extension of endometrial glands into uterine myometrium. You see that? Okay, so that's basically endometrial gland goes to the second layer. Okay, that's adenomyosis. It's caused by hyperplasia of a basal layer of the endometrium. Patient comes with dysmenorrhea, abnormal uterine bleeding. Some book says AUB. If you see the text, first aid says AUB, that's abnormal uterine bleeding, okay? And they will also put heavy menstrual bleeding, HMB. That's heavy menstrual bleeding. That's what it stands for, AUB and HMB, okay? Now, and uniformly enlarged, and I want you guys to highlight this globular word. What does that mean? Whenever it happens, it's symmetrical, folks. It enlarges equally. So it's symmetrical enlargement. That's important because there's another disease. It's asymmetrical. We're going to talk about that. Okay. So adenomyosis, it's enlarged equally everywhere, folks. Now look at the treatment. We give them GnRH agonist, or we have to do hysterectomy, or sometimes they could cut and take those adenomyoma, depends on the severity. We don't need to worry about treatment. The definition is what matters. So endometrial glands is moving to myometrium. Is everybody clear, folks? All right. Next, Asherman syndrome. It's an adhesion and fibrosis of the endometrium. Okay, so simply keep it fibrosis of the endometrium. Let's go back here, folks. Now, let's say somebody become pregnant and they didn't want that baby and they have to do abortion. Okay, so they are doing the abortion. After the abortion is done, they have to do a process called DNC. Is that clear, folks? What is DNC? Go into the endometrium. They kind of scrape the whole endometrium and clean it out. Does that make sense, folks? That's a dilation curettage. That's a process. It's basically cleaning the whole endometrium. And sometimes they scrape, okay? They do that and they damage the endometrial tissues. Does that make sense, folks? When endometrial tissues are damaged, they get repaired. When they get repaired, it becomes a scar tissue. Does that make sense, folks? And whenever it's scarred, we call it fibrosis, okay? Now you could see presence with decreased fertility. After that, they cannot get pregnant easily. Recurrent pregnancy loss, abnormal uterine bleeding and stuff. Look at this, often associated with DNC. Is everybody clear, folks? Now, this is why it's important, folks. When people, we tell them when they want to do abortions, you want to go to a proper hospital and proper facility, because the DNC can be done professionally properly, or some people can get it done for cheaper. When you do cheaper, the instruments and technology is not there. Those are the people get this kind of things, folks. Because what happens is teenagers and youngsters, sometimes they become pregnant and the family don't know, and they just go to a place that somewhere far that nobody knows, and they go get the DNC done so nobody knows it. But when they go to that kind of facility, they don't have proper instrumentation. Is everybody clear, folks? And then that's the idea, and it's cheaper too, but you never want to do that because that will cause a big time. Now what happened? Most of the endometrium is scar tissue, so that means fertilization cannot happen. Is everybody clear, folks? All right. So that's Asherman syndrome, okay? It's simply your endometrium is fibrotic. Clear? Okay. Next one. Endometrial hyperplasia. The minute we use the word endometrial hyperplasia, estrogen should spike your brain. Okay. Abnormal endometrial gland proliferation, usually stimulated by excess estrogen. What's the name of the cell that produces estrogen in the ovary? Type it up. Let's see. How many people knows that? Granulosa cell. Okay. It's granulosa cell. Look at this, guys. So they are given here. Granulosa cell tumor. Okay, so granulosa cell is the one that produces estrogen. So whenever you have increased estrogen, that causes endometrial hyperplasia. Endometrial hyperplasia can increase risk of patient with endometrial carcinoma. Okay, postmenopausal vaginal bleeding. I want you guys to highlight that. When you say postmenopausal vaginal bleeding, right? Now keep in mind, folks, if somebody is postmenopausal, they should not even have a drop of blood coming out. Is everybody clear, folks? If a postmenopausal woman comes and she says, I'm 66-year-old, I just had one drop of blood coming out, we send them to biopsy right away. Because whenever postmenopausal woman comes with the bleeding or drop, even a little spotting, we do biopsy because it's always endometrial carcinoma until proven otherwise. Is that clear, folks? We have to do the biopsy, okay? We have to do the biopsy. That's very important, folks, because when a postmenopausal woman is bleeding, it's beyond endometrial hyperplasia at that point, folks, okay? Careful. Increased risk with anovulatory cycles, hormone replacement therapy, because granulosa cell tumor, which makes sense because granulosa cell normally produces estrogen. If you have malignancy, now they're overproducing. Is that clear, folks? That's the idea, okay? That's endometrial hyperplasia. Since we did endometrial hyperplasia, I want to kind of quickly do endometrial carcinoma. So that goes with that. Most common gynecologic malignancy. You see that? Presence with irregular vaginal bleeding. There are two types, endometrioid and serous. Most commonly, we're going to talk about endometrioid. That's the most common. In the exam, they only ask that. Most cases are caused by unopposed estrogen exposure due to obesity. Why obesity gives you estrogen? Aromatase enzyme that can convert androgen to estrogen. But also associated with early menopause, late menopause, all these things, folks. Okay. That's all you need to know. Then know the other one too, just in case, serous type. Here it's opposite. It's endometrial atrophy, actually. You see, it's not hyperplasia, it's atrophy. That also can be a cancer. Very aggressive, actually. This can be aggressive. Highlight, they also have Somama bodies. So this should be like a third or fourth disease we are studying Somama bodies, okay? I'm not gonna ask what are the other diseases, but I hope you guys remember. So that's Somama bodies, folks, okay? Now, these are two types. So always remember endometrial carcinoma, it's such a danger condition, folks, okay? A true story, it happened about 6 years ago. One of this person, she was like 71 or 69. She literally said that she had like 2 or 3 drops of blood comes. So she ignored it because, 2 or 3 drops, they were like, okay, if it happens again, normal psychology. If it happens again, I will go these things. She ignored it. And then we suspected after a while different symptoms and stuff. Then we found out, by the time we found out, she had endometrial carcinoma already spreading to the abdomen, stomach, everywhere. Okay, everywhere. So we did a total abdominal hysterectomy, which means it's a big surgery. Here, uterus comes out, everything comes out mostly, folks. Still, we couldn't do anything that spread to the stomach. Okay, the interesting thing is she has one son. The son and her daughter-in-law, they both are doctors. And the son is my colleague. Okay, so I was there. She died in front of me in the hospital with a gastric cancer. It spreads everywhere. We have to increase the dose of morphine. When you do, that's what we do at the terminal illness, right? You increase the morphine, it reduces the respiratory rate. So the key is, she could have told his son or my daughter-in-law. Her explanation was, it was only like 1 or 2 drops. I thought I would tell if it happens more, but it stopped after 2 drops. You see, at 2 drops of blood, how much it changes somebody's life, right? So that's something, guys, you have to be very careful when patient comes. And she had all the symptoms. She's obese and everything was perfect on that. Okay, so remember that. Always biopsy. The first thing is biopsy. Okay. All right, so that's endometrial carcinoma. Everybody clear? Okay, now let's go to endometriosis. Now I need to be careful. There's another condition called endometritis, not endometritis. This is endometriosis, okay? To make it simple, endometriosis has no infection. Endometritis has infection. Okay, very important to differentiate. Now, endometriosis. Let's recall adenomyosis. What did we study about adenomyosis? Endometrial glands are moving from endometrial layer to myometrium. Is that clear, folks? That's adenomyosis. What is endometriosis? Same endometrial glands are moving, but they are not moving in the uterus. They're actually going outside the uterus. They are going completely outside. So I call adenomyosis as domestic. They go within the uterus. Endometriosis is international. They go outside. Is that clear, folks? They are not in the uterus itself. They are going different areas. They go to pouch of Douglas. Pouch of Douglas is the area behind the rectum. They could go to ovary. They could go to, there's a case that documented it went to pericardial cavity. It can spread anywhere, folks. Okay, so that's called endometriosis. Look at this. Endometrium like gland or stroma outside the endometrial cavity. Is everybody clear, folks? Most commonly in the ovary, frequently bilateral, pelvis and peritoneum. See, it can go anywhere. Okay. In ovary, it appears as endometrioma. So the blood is filled. That's why it's called like a chocolate cyst. It looks that color. Okay. Maybe due to retrograde blood flow, metaplastic transformation, and the transportation of endometrial tissue via lymphatic. Highlight that. This was an NBME question. Nobody got this right. They simply asked, how did it spread from one area to the other area? Through lymphatics. Because it's going through lymphatics, if I ask you, tell me one organ, it will never go. What's your answer? Brain. Because why? Brain don't have lymphatics. Is that clear, folks? So something to keep in mind, okay? So it goes through lymphatics. Presence with pelvic pain, dysmenorrhea. You see, dyspareunia, right? That's a painful intercourse. This used to be the buzzword. Anytime when we studied for step 1, anybody, any questions say dyspareunia, we were like endometriosis, right? Everybody knows that. So they kind of overuse that word. Nowadays, they are not really using a lot. I'm not saying they don't, but they reduce. They bring different one. Dyschezia, that's a word they started using now. That's painful defecation, folks, okay? So when they are trying to pass the stool, it's very painful. Why? Because these endometrial glands are going into the pouch of Douglas or in the rectal ligaments. It's sitting behind the rectum. When they deposit behind the rectum, every time we pass the bowel movement, we need to stretch the rectum. That causes the pain. Is everybody clear, folks? So don't always look for dyspareunia. Keep an eye on this one too, folks, okay? Now, abnormal uterine bleeding, infertility, okay, and normal size uterus. Very important because there's nothing wrong in the uterus. It's all going outside, isn't it, folks? Okay. Now, also remember, the pain is a cyclic pain. Why? When do you think endometrial gland proliferates? With the menstrual cycle, isn't it, folks? So it's a cyclic pain, folks, okay? Now, treatment, you could do all of them, but the best treatment is this, laparoscopic removal. So basically, we go and have to remove that tissue, folks. We have to go and start.
What's that written below endometriosis?
Say it again?
What's that's written below endometriosis, like no interstice?
I'm not hearing it. It's not clear. What were you saying?
Like, what is written below endometriosis? No interstitial.
Below no infection.
Okay.
So it doesn't have any infection, okay? Because you see, when we talk about endometriosis, there is no reason for infection here. Is everybody clear, folks? Because the word of endometriosis and endometritis, in the exam, if you read it fast, you will miss it. Okay, you have to be careful. So that's laparoscopic removal, folks, okay? Is everybody clear? So we call laparoscopic removal diagnostic and therapeutic. Sometime in medicine, you use that word, diagnostic and therapeutic. What does that mean? That means we use the laparoscopic to diagnose 100%, and also right away we can remove it too. So one process do both, diagnosis and therapeutic. Is that clear, folks? So that's what that means, okay? So that's endometriosis, folks, okay? And it's also, I wouldn't say pretty common, but it's also there, most of the females. That's endometriosis. Next, endometritis. Okay, now when we talk about endometritis, it's an inflammation of the endometrium associated with the retained product of conception following a delivery. See, we were talking about when the delivery happens, if you don't remove the whole placenta and let's say you leave a little piece of placenta inside, that can cause endometritis because it will attract infections and organisms. Okay. Miscarriage, abortion, foreign body, intrauterine device, okay? All these things can, retain material or bacteria from vagina and GI tract. Remember, folks, what's the normal flora of the vagina? Type it up. The normal flora. Because vagina has a pH, that pH needs to be maintained. Is everybody clear, folks? So what's the normal flora? I have one answer. Come on. Don't type alkaline, acidic, all these things. I want the name of the flora. What's the name of the organism? Lactobacillus. Okay. Lactobacillus is very important, folks. Okay. Lactobacillus. Okay. So that's important. Because why? The lactobacillus is normal for vagina, but not for uterus. Does that make sense, folks? It's two different departments, two different structure. Okay. It's not that. So that's one of the reasons, the infections, folks. Okay. Chronic endometritis shows plasma cell on histology. We are not worried. Treatment, antibiotic. Now, I'm going to highlight ampicillin. Highlight ampicillin. This is a question, comes on the step 1 exam. If I am prescribing somebody ampicillin, what organism am I targeting in my mind? Because ampicillin covers only one organism. Type it up. What's that organism? So whenever we think ampicillin, that's the only thing. Listeria monocytogenes. Okay, so you should always know ampicillin is just for Listeria monocytogenes. The question was on the step 1 exam. This physician add ampicillin to the prescription. Which of the following organism is this doctor trying to cover for? Listeria monocytogenes. Is that clear, folks? So that's important. Okay, ampicillin is only covering that. Okay, so that's endometritis infection, folks. Okay, so that's that. Now, continuing here, the last part, leiomyoma, which we call fibroid. That's also pretty common nowadays. Okay, fibroids. What is fibroids? Okay, it's a benign, most common tumor in female, often presents with multiple discrete tumor, increased incidence in Black patients. That's, most of everybody has it. Benign smooth muscle tumor. Malignant transformation is rare. You see, it's benign, so they don't get malignant that easily. What I want you guys to learn is estrogen sensitive. What does that mean? Before menopause, that can grow so big because estrogen is there. After menopause, there is no estrogen. It will shrink. Is that clear, folks? All right. Tumor size increase with pregnancy and decrease with menopause, okay, which makes sense. And you could see the picture D here. Those are those tumors, folks, okay. Now, if I were to show you on this diagram, the way leiomyoma looks, it's like this. You see, random places, one in endometrium, one in the perimetrium, one is somewhere. Would you say this is a symmetrical? No. Leiomyoma is always asymmetrical. It's always asymmetrical. Compare that with first one, adenomyosis, which is symmetrical. Is that clear, folks? So this is asymmetrical. Peak occurrence at 20 to 40 years. Maybe asymptomatic. Some people have bleeding. Severe bleeding may lead to iron deficiency anemia. Some people don't even know that they have this. They only come to the hospital because they are fatigued and tired and they look pale. Why? Because they've been bleeding for a long time. They ignored it. Now the iron is so low and they have anemia that causes fatigue. Is that clear, folks? All right. There's a smooth muscle bundle. I wouldn't worry about it. Okay. So that's leiomyoma, what we call is fibroid. You could remove some of the fibroids. If not, you have to remove the whole uterus. Depends on which type they have. Okay. Now, leiomyosarcoma, which is very rare, but that's a malignant proliferation of the same smooth muscle from the myocardium. Usually in postmenopausal female folks, okay? That's something you want to keep with the area of necrosis. That's the whole condition. So